Just waiting for the confirmation, then we'll start with the session. Okay, so we have a go ahead. So once again, good evening everyone. Myself Dr. Rijul Agarwal, I'm the Orthodontic faculty at DAMS. So today's session is for the last INI exam, which happened on 10th of November of this month on Sunday. So this is a recall session to discuss the questions of the subject of orthodontics. Please note, इन सेशंस का एम ये नहीं है कि किसी पे वोट आना ये गलत हुआ, किसका कितना सही एंड ऑल दैट. द एम विथ विच वी टेक दिस सेशंस इज कि जो क्वेश्चंस हुए हैं विच हैव ऑकर्ड और विच हैव कम इन द एग्ज़ाम्स, उसमें से क्या कमी was there from your side and as well as ours, what was covered, what was left. If there was something which was missing from our side, we'll add it up. If there was something missing from your side, you have to cover it up. Okay, so the aim with which I will take the session is I'll take up those questions, okay, and highlight ki kya we have covered in the class and what was not there. Okay, I'm not going to categorize the exam as easy, moderate, difficult because it varies. कितनी किसकी तैयारी है, depending upon that the student will tell was it easy for them, was it difficult or not. Okay, so I'm not here to judge the exam nor anyone. I'm just here to tell कि what happened has happened. We have to look for the future. Okay, and the future is coming which is in the form of a NEET exam. So we have to look for that. Okay, so once again, good evening everyone. We'll start. So these are the recall questions. If anyone has anything to add, you can mention in the comment section. We'll add those points as well. Okay, so one thing which this paper taught us was that many questions came from the topic of growth and development. In the past few years which I have taken up, everyone has this complaint that why do we waste so much of our time on growth, studying growth. I approximately take 2 days of your time to cover growth. So this exam, उसको highlight किया या उस time को well spent consider किया इस exam ने, because there was a number of questions out of 14 questions which you have recalled, approximately 4 to 5 questions have come up from growth and development, direct pick up from the notes. So मतलब कुछ something was not there कि जो उसमें बहुत दिमाग, direct pick up. So it was very much worthwhile to spend our time on that topic. Okay, तो इसका मतलब ये नहीं कि other topics are not important, they are equally important. It was just that at this exam the examiner's favorite topic or choice was growth and development. Okay, so beginning with the questions. First question: formation of maxilla happens by which of the following mechanisms? Mesenchymal condensation, endochondral ossification, persistence of zygoma or malar cartilage throughout life, loss of condylar cartilage just before birth. Okay, simply they are asking काफ़ी complicated options के साथ कि क्या maxilla intramembranous ossification से बनता है या endochondral ossification से बनता है. And as we all know, very easy question, I would like to say that maxilla forms by intramembranous ossification, और can say जिसको उन्होंने घुमा के लिख दिया mesenchymal condensation. अगर मैकेनिज्म ऑफ इंट्रामेम्ब्रेनस या एंडोकॉन्ड्रल ऑसिफिकेशन याद हो तो उसमें होता क्या है, पहले एक्टोमीसेंकाइमल सेल आते हैं, वो डिफ्रेंशिएट होते हैं. अगर वो डिफ्रेंशिएट होकर कॉन्ड्रोब्लास्ट बन जाएंगे तो कार्टिलेज सिक्रीट करके ऑसिफाई होकर एंडोकॉन्ड्रल बोन बनाएंगे. अगर वो आके डिफ्रेंशिएट होकर सीधा ऑस्टियोब्लास्ट बन जाएंगे तो इंट्रामेम्ब्रेनस बोन बनाएंगे. ओके, सो वेरी इजी क्वेश्चन एंड अ डायरेक्ट पिकअप. सो जस्ट अ क्विक रिवीजन ऑफ द बोन्स ऑफ द क्रेनियोफेशियल रीजन. कौन सा किस से बनता है, Okay, maxilla is purely intramembranous, mandible is both, cranial vault is intramembranous and base is endochondral, जिसमें से अलग बोन्स अलग तरीके से बन रही है. ethmoid is purely endochondral. Okay, rest are mixed. Okay, sphenoid में जैसे body of sphenoid and lesser wing is endochondral. Pterygoid plates are intramembranous and greater wing both intramembranous and endochondral. A direct pick from our class notes. Okay, nothing much to discuss. Next question. In a 5-year-old child, how many growth centers are present in mandible? अब उस क्वेश्चन को सिंपल सा क्वेश्चन उन्होंने जस्ट ट्विस्ट करा एंड जस्ट राइट वर्ड डाल दिया ना 5-year-old चाइल्ड. अगर 5 हो, 10 हो, 15 हो, 50 हो, ग्रोथ सेंटर मैंडिबल अगर ह्यूमन बीइंग है उतने ही रहेंगे. ओके, सो अगेन अ डायरेक्ट पिक. जस्ट वी ऑल नो देयर आर 2 ग्रोथ सेंटर्स इन मैंडिबल. Where are they located? In the region of mental foramen. Okay, so primary ossification centers of the mandible, there are 2 in number, located in the mental foramen area. Okay, lateral to the Meckel's cartilage. We all know what is growth centers, what are growth sites. Growth centers are the genetically determined centers जहाँ पर growth होती है, which is genetically regulated, not influenced by environment. Okay, located lateral to the Meckel's cartilage at the location bifurcation of inferior alveolar nerve. Okay, again a direct pick. Okay, so as I told in the beginning, अगर growth part lag कर रहा है, नहीं पड़ा है या skip हुआ है या clear नहीं है, okay, whatever, now is the high time. This paper has shown in the mirror, okay, कि this part is equally important to consider for studying orthodontics. Okay, none of the topics which we have taken or anyone has taken in the class are not important. We have given our time because they are important for your classes, for exams. Okay, so growth center, growth sites किसके कितने होते हैं, just go through them. Okay, next question. This was I can directly say this was a very easy and a PYQ. डायरेक्ट रिपीटेड क्वेश्चन, एक्सेप्ट प्रॉब्लम बस एक ऑप्शन चेंज किया. 9 लास्ट टाइम उन्होंने दिया था 7 years, इस बार उन्होंने एक ऑप्शन 9 years किया. रेगार्डलेस ऑप्शन वो इनकरेक्ट ही है. ओके, नेजल बोन ग्रोथ कंप्लीट्स एट व्हाट एज? ओके, ऑप्शंस आर 9, 10, 11, 14. लास्ट टाइम 7 था, एक ऑप्शन 9 नहीं था, 10, 11, 14. रिगार्डलेस ऑफ दैट डायरेक्ट पिकअप क्वेश्चन. ओके, आपके क्लास टेस्ट उसमें भी काफ़ी दिया है. इट्स 10 years. ओके, सो ग्रोथ ऑफ द नेजल बोन इज कम्प्लीटेड अबाउट एज ऑफ 10 years. ओके, एंड ओके देर आफ्टर जो ग्रोथ होती है वो सॉफ्ट टिश्यू की होती है नोज़ के. द नोज ड्रूप्स डाउन. अगर हम एज रिलेटेड चेंजेस ऑफ सॉफ्ट टिश्यू देखेंगे तो विद एजिंग नोजल टिप ड्रॉप्स डाउन. ओके, एज दैट ऑरिजिन ग्रोथ स्पर्ट अकर्स. Next question. What among the following is true for TADs? About TADs. TADs are what are known as temporary anchorage devices. These are devices, these are orthodontic implants used for anchorage consideration. Okay, so the options which I got were patient friendly, less time consuming, or better anchorage. Okay, patient friendly, I cannot say they are patient friendly or not friendly. Okay, less time consuming, they take roughly equal amount of time. The reason with which we place TADs is if these options came in the exam is they provide better anchorage. Okay, they provide a better anchorage as compared to conventional anchorage devices like TPA, TLA or anything. If anyone has the options or the options which we have got are incorrect, can write in the comment section and we'll make the changes and answer it accordingly. Okay, so which of the following is true? So TADs are used, or temporary anchorage devices are used to provide anchorage for orthodontic appliances. Okay, moving ahead. Image based question. Okay, so what I got कि ये image थी जिसमें there was labeled as A, B, C, D or likewise A, B, C, D could have changed. Whatever, we are here to discuss the crux of the question and it was a multiple answer type correct question asking about which will have more anchorage than considered to this, which one. Okay, and of course in exam they did not mention this anchorage values, they just give you these diagrams. Okay, basically upper 1 to 3, upper 765, lower 765, lower 3 2. Okay, so basically this was a question from about Freeman's anchorage value diagram. Okay, Freeman's anchorage value diagram, जिसमें based on the periodontal ligament surface area किसका कितना anchorage value ज़्यादा है कम है. Okay, इन्होंने instead of asking you directly about the anchorage values, they expected you to know about those anchorage values. Okay, and answer them accordingly. Okay, so based on those values you need to answer which one has more anchorage, and based on that permutation and combination you have to pick up the correct statement. I did not get all the options. Okay, that's why I've taken up the question. Okay, and as I told, we are not here to find the correct option here, we are here to understand the concept. Concept nahi pata hai, so we can take up. So as I told you, the anchorage value of the tooth can be thought of as a function of its root surface area. Okay, which is same as that of its pedal area. जिसका जितना पेरिडोंटल लिगामेंट सरफेस एरिया होगा, जितना पेरिडोंटल लिगामेंट सरफेस एरिया होगा, मतलब रूट कवरेज होगी. अपर मैक्सिलरी मोलर्स हैज 3 रूट्स, लोअर हैज 2, so it will have more surface area, more periodontal ligament connection, more anchorage value. Okay, so you say there are 4 options and not 2. I know. Sorry for that. I understand, Bhavna, there must be 4 options, but the ones which I got recalled, I mentioned that if you have those 4, we can very well write them. Okay, but here we are here to discuss the concept and not the options. कॉन्सेप्ट ये है इस क्वेश्चन का कि यू शुड नो अबाउट द फ्रीवेंस एंकरेज वैल्यू और द एंकरेज डिटरमिनेंट. क्वेश्चन में अगर प्रॉब्लम है रिकॉलिंग में, जस्ट मेंशन, आई विल जस्ट राइट. ओके, एंड इफ यू हैव द 4th ऑप्शन, सेकंड, थर्ड 4th ऑप्शंस, वेरी वेल, जस्ट राइट, गिव अस. ओके, ए एंड बी. इफ यू हैव द ऑप्शंस, कैन यू जस्ट राइट देम, बी एंड डी. ओके, so you mean to say that instead of asking about which of the following is correct, which of the following were, if you can recall the correct complete question, I can take up the following. That will be a much help. Anyhow, moving ahead, function of the component marked. So this was a image based question. The image was of a Frankel appliance. Okay, and from what I got to know, they marked or they wanted to ask you about the function of this component. Okay, and what is this? This is the vestibular shield, and similar vestibular shield कहाँ होती है? Similar mechanism of action as that of oral screen. What does it do? It shields away the action of the buccinator or cheek muscles. से होगा क्या? सेम चीज, शील्डिंग अवे होगा तो क्या होगा? पैसिव एक्सपेंशन. सर यू मार्क्ड रॉन्ग. अपर एंटीरियर मार्क्ड एज लोअर, अपर सी मार्क्ड एज लोअर एंटीरियर बी. Just a minute, we need to go back to this question again. Okay, so you are saying that upper anteriors marked as lower anterior B. Sorry, I'm not getting. Maxillary incisors are more than mandibular incisor was different. Let me again come back to this question. So this question was based on the Freeman's Anchorage value. Okay, so what does it say? Freeman's Anchorage values बात करता है based on the periodontal ligament surface area. Okay, question was related to that. Okay, I don't know कि ABCD उन्होंने कैसे मार्क किया था. Upper anterior marked as, lower anterior B, upper anterior marked S, lower anterior B, upper anterior C. So okay, you mean to say exam में upper anteriors were marked as A, lower anterior as B, upper posterior as C, and lower posterior as D. ठीक है, we corrected it. Okay, but that will not change our concept right now. Okay, what I mean to say is अगर हम anchorage value की लेंगे तो C will have the most anchorage value, and they compared maxillary and mandibular incisor and also posterior. अगर मैं इसको लेना चाहूँ, they were the option C will have the most anchorage value, then we'll have D, then we'll have A, then we'll have B. अगर इसी ऑर्डर में आया था. I hope I'm clear now. Okay, upper posteriors will have the most anchorage value, followed by the lower posteriors, then thirdly we'll have upper anteriors, and lastly we'll have lower anteriors. Okay, now I hope I am clear with the concept. किसी को इस concept में कोई issue है, just tell me. और next question, as we are discussing about the function of the component mark. If anyone has the options of this question as well, about this image based question which asked about the function of the component mark, you can just write, tell me, and I'll be happy to add them here and discuss. Basic concept क्या है उन shields का I have just discussed, that these are the vestibular shields. Okay, their function is to shield away the buccal mucosa or the buccinator muscle so as to achieve passive expansion. Okay, and lastly they can also say that it works on the theory of growth theory of functional matrix hypothesis. So again, a direct question, option C was the answer. Bhavna, if you can recall the option. I understand it, you must have marked it correct only. Okay, if anyone can recall the options of this question as well, we'll be able to add. Okay, next question, force into movement relevance in orthodontic treatment. So yes, buccal expansion will be there, that's what I mentioned, passive expansion. Buccal expansion will be there. Next question, force into movement relevance in orthodontic treatment. Okay, हमने क्लास में पढ़ा है movement to force ratio. अगर biomechanics में जाए, okay, movement to force ratio जिसके बेस पे, and movement क्या होता है, force into distance. Okay, the point, अगर एक body है, एक supposedly tooth है, हमने उसके center of resistance से एक distance d पे एक force लगाई, so the amount of movement or the rotational tendency of that tooth will be defined as movement, and its value is force into. Question 7, other options, direction of tooth movement, Okay. Force of tooth movement. And if anyone has the fourth option as well, we can add them. Okay, so movement to force ratio or movement क्या होता है, I've just told you. So based on these three options which I have, that is type of movement produced, direction of tooth movement और force of tooth movement. Force of tooth movement cannot be there because कितना force लग रहा है, क्या हो रहा है. Okay, movement into force can नहीं बताएगा. Okay, direction of tooth movement will be in the direction of the force applied. Okay, so that will also be eliminated. अगर movement और force दोनों का interplay है, then it will only tell about type of tooth movement which is occurring, whether it is controlled tipping, uncontrolled tipping, bodily movement, root movement, whatever. So the correct answer है जहाँ force movement का दोनों का interplay आ रहा है, that is type of movement. Force into movement करके concept orthodontics में नहीं है. Basically we have a concept of ratio of these two, not a multiplication factor. So I am sure the examiner would have or thought of asking about that only. Okay, so the correct answer is type of movement produced. Okay, multiply करने से it won't tell you about direction of tooth movement or the force of tooth movement. Okay, I hope this concept is clear. Moving ahead, next question. In orthodontic treatment, what makes teeth more prone to root resorption? Again, question from biology of tooth movement, जिसमें single rooted tooth, root canal treated tooth, light and continuous forces. Fourth option I did not get. If anyone has, I can add it to them, or is there any correction in these four options? We can correct. Okay. Anyhow, getting back to the question, root resorption कब होती है? Due to uncontrolled or high forces की वजह से. Okay. So uncontrolled or high forces की वजह से root resorption occurs during tooth movement. So light and continuous forces do not cause root resorption. Okay, single rooted tooth or root canal treated tooth. Root canal treated tooth will have lesser root resorption. Why? Because pulpless teeth say the root resorption factors or the factors which causes resorption of the root are reduced from the pulp of the teeth. अगर teeth is already root canal treated, उसमें tendency to have root resorption is reduced. Okay, so out of these three, the best would be a single rooted tooth, which is more prone to root resorption. Okay. Next question. Posterior airway space in an average is about. Options are 5 to 10, 10 to 15, 15 to 20, 20 to 25. This question was based upon McNamara's analysis. This was volumetric analysis for functional jaw orthopedics. कोई भी functional treatment शुरू करने से पहले और mandibular advancement, if you remember, मैंने obstructive sleep apnea when I took up OSA, there we discussed this analysis. I just mentioned it in name, and there I mentioned specifically about the dimensions of the airway. Okay, so posterior airway space. So one point which if I had mentioned, just added, McNamara analysis is used for functional. Before beginning functional appliance therapy, we do McNamara's analysis, and basically this is analysis to initiate or check about the mandible length, how much advancement, okay, what is the initial length of the mandible and how much advancement is to be done. Okay, so from where do we measure? We have two dimensions in this. These are the upper pharyngeal width and the lower pharyngeal width. Okay, upper is measured from the posterior outline of the soft palate to the closest point on the pharyngeal wall. Okay, and lower pharyngeal width is measured at the posterior border of tongue and the inferior border of the mandible. to the closest point on the lowest posterior pharyngeal block. Okay, so the answer here is option B, that is 10 to 15 mm. Okay, अगर इसमें अपर और लोअर फेरेंजियल विड्थ अलग अलग पूछे तो अप्रॉक्सीमेटली अपर होती है, its upper is more, approximately 15 mm, and lower pharyngeal width is less, that is approximately 10 mm. So best range they have given is 10 to 15, hence the correct answer. Okay, moving ahead, a controversial question here. In transverse maxillary arch deficiency, how will the teeth compensate? Okay, buccally placed or tilted maxillary, buccally placed or tilted mandibular, bilaterally placed tilted maxillary, or lingually placed or tilted mandibular teeth. So what is transverse maxillary arch deficiency? What we mean to say is the maxilla is narrower than the mandibular arch. These are the maxillary teeth, these are the mandibular teeth. The mandibular teeth are outside and the maxillary are in. If we remember from compensation, decompensation from orthodontic surgery of class 2 and class 3 malocclusion. Okay, so similar kind of mechanisms occurs in transverse deficiency as well. So what happens? Nature tries to compensate the skeletal discrepancy, उसको छुपाने की कोशिश करता है. Why? अगर ये दांत ऐसे ही रहेंगे the teeth won't occlude. If the teeth won't occlude, what will happen? Max occlusion नहीं होगा तो patient chew नहीं कर पाएगा. So what does nature do in transverse cases? Maxillary teeth get buccally tilted and mandibular teeth get lingually tilted. The mandibular posterior and maxillary posterior teeth, so that they come in occlusion to achieve chewing. Okay, so here options में they were both the options, that is buccally tilted maxillary and lingually tilted mandibular teeth. So technically both of these are correct. So I hope that the examiner would have given you not both of them. Okay, but since the recall says that both of them are present, so the better option out of these two, or if the question comes as it is once again in your exam, in future exam, the question correct answer would be option A, that is buccally placed or tilted maxillary teeth, that is A better than D. Okay, so A, that is buccally tilting of the maxillary teeth, will be a better option in transverse maxillary deficiency cases. Okay, so this was the question. Again, moving ahead, the child chewing pattern is converted to adult at what age? Okay, or there were two recalls. Someone said that it was about chewing pattern, some said it was about a swallowing pattern. Both of them we have discussed in a class, again from the growth topic, growth and development. Just a minute. Both of them from the growth topic. Sorry. Okay, so अगर chewing pattern पे question आया है, so transition from juvenile to adult chewing pattern develops with the eruption of permanent canines, that is about the age of 12 years. Okay, and अगर swallowing pattern पे the question was there, that is the transition starts from 6 months with the eruption of primary incisors and is well developed by 18 months. Okay, some says by 4 to 5 years. So whatever form of question came, okay, it was already discussed. A direct picked question. Next, development of upper lip. This was a question which I mentioned in the predictor series as well. Cleft K, sir, minimum marks to get a seat. Okay, यार ये तो कोई डिफाइन नहीं कर सकता because INI has percentile pattern. ओके, और अब तो सीट्स भी काफ़ी ज़्यादा हो गई है, सो वन कैन नॉट रियली गेट टू नो हाउ मच मार्क्स पे कट ऑफ होती है. सो आई वुडंट बी एबल टू हेल्प यू ऑन दिस बिकॉज मार्क्स तो कभी दिखाते ही नहीं. ओके, सो कमिंग बैक टू द सेशन. ओके, एनी हाउ the thing which I mentioned in the beginning as well, अब जो दे दिया वो दे दिया, ओके, रिजल्ट आ जाएगा सैटरडे तक, ओके, वॉट एवर यू गेट स्कोर यू गेट टू नो, जहाँ पर लैगिंग है जस्ट प्लीज फोकस ऑन दैट, ओके. Moving ahead, development of upper lips. As I told you, this topic I mentioned in the predicted series as well. In each of the exam, they are asking about this question, upper lip development, or same kind of question. ये cleft lip, इसका different variety offered in the PVIQ. Okay, कि cleft lip, how does it occur? You do defective fusion of what? Okay, so same kind of question, घुमा फिरा के they are asking you earlier as well. Okay, so I would consider this as a P by Q only. Just उन्होंने instead of asking about cleft lip कैसे होता है, this time they ask you about development of upper lip. So the correct answer you all know is median nasal and maxillary process. Okay, moving ahead, another question, another P by Q I would like to say. Diameter of finger spring is made twice. Effect on strength. I think I shouldn't discuss this. We have discussed this at length in class. Okay, so अगर diameter twice कर रहे हैं, strength will be increased by 8 times. That is fourth power of the diameter. Okay, so doubling the diameter increases the strength by 8 times, decreases springiness by a factor of 16, and range by a factor of 2. How are these related? This is how. और अगर वही चीज़ हम लेंथ पे देखें उसका उल्टा. ओके, नेक्स्ट और द लास्ट क्वेश्चन और द मोस्ट डिफिकल्ट, और आई कैन से द क्वेश्चन विच आई कुडंट से आई हैवंट टेकन अप ड्यूरिंग माई लेक्चर्स, सो आई विल टेक अप द blame for this question myself only. That is the gene responsible for malocclusion. The options which I got were FGFR, PAX9 or MSX1. Okay, if these options were there in the exam, okay, I'll wholeheartedly take the blame for this question because I did not taught you this in the class. Okay, so looking at the question, अगर हम studies, I have also looked up through various studies since the time I got this question. Technically, if you look at FGFR is fibroblast growth factor related gene. ये responsible है for the formation of Cruzon syndrome or the craniosynostosis syndrome scale. PAX9 और MX1 सब रिस्पॉन्सिबल है डेंटिनोजेनेसिस के लिए. मतलब अगर ये जीन में म्यूटेशन होगा तो टूथ नंबर या टूथ बनेगा ही नहीं. ओके, टेक्निकली अगर हम malocclusion के पॉइंट से लिखें सो ऑल 3 are responsible for malocclusion. अगर craniosynostosis syndrome होंगे, defective cranial base होगा, it will lead to defective jaw growth and development and subsequently malocclusion. Similarly, PAX9, MSX1. So I cannot give you a definite answer, to be honest, कि which one is right. I have studies to support that each of these genes is responsible for some kind of malocclusion. अगर इसमें fourth option, if possible, there were DLX gene was there, okay, then that would have been a much better answer. Okay, so अगर definite answer for this question does not exist because all 3 or all can say all 4 are responsible for malocclusion. So let us assume that this same kind of question would have come or can come in your next or future exam. So out of these 4, I would like to mark DLX as the one primary one, then MSX1. Okay, how? So MSX1 is related to tooth agenesis as I already told and cause malocclusion. Okay, fibroblast growth factor is related to development of abnormal development in the jaw bones or jaw bases can result in class 2, class 3 type of malocclusion. PAX9 is likely linked to tooth development and is expressed in the early development and formation of tooth buds. तो अगर PAX9 mutation होगा can lead to similar kind of malocclusion. Similarly, DLX gene, okay, particularly DLX5 and 6 are considered as key regulators in defining the lower jaw identity, okay, and is forming the resulting in malocclusion. Okay, few of the further genes which I could like to mention: particularly axin, responsible for tooth agenesis; EDAR gene, responsible for crowding; Adam ST is responsible for class 3. और ग्रोथ फैक्टर जहाँ जहाँ भी जिस जीन में अगर ग्रोथ फैक्टर टर्म है, जैसे FGFR, IGF, VEGF, जहाँ पर GF टर्म आ रहा है कहीं पर भी, ओके, तो उसको क्लास 2 से लगा देना. इट इज रिस्पॉन्सिबल क्लास 2 malocclusion, skeletal malocclusion. Okay, so the last question, still not, I don't have a correct or a definite answer for that question. Okay, अगर if I have studies to support each of these 4 options कि कौन सा correct है, which is responsible which malocclusion. Okay, so I don't know, जिस examiner ने question डाला है, he or she must have read some article or somewhere and put up the question without thinking about other options as well. Okay, so you cannot say comment that one particular gene is responsible for malocclusion. All 4 have equal and important role. Okay, अगर यही option as it is आए तो I would suggest mark DLX as the topmost one responsible for malocclusion. FGFR थोड़ा syndromic association होता है, so question is gene responsible craniofacial which is implicated in ortho treatment. Can you be more clear with the question? Gene responsible in craniofacial region which is implicated in orthodontic treatment. All of these 4 genes पे research हुई है. There are articles, the scientists have tried to incorporate. अगर इन जीन का mutation they have seen that अगर हम इस जीन को mutate कर दें, ओके, और इफ वी ट्राई टू इनकॉर्पोरेट, बिकॉज जीन से क्या प्रोड्यूस होता है, व्हाट इज द साइकिल, फिनोटाइपिक साइकिल, जीन्स एक्सप्रेस प्रोटीन. क्रेनियोफेशियल सिनोस्टोसिस वाज देयर, एज वाई मस्ट मार्क FGFR सर. अगर क्रेनियोफेशियल रीजन से रिलेटेड है तो FGFR होगा डेफिनेटली. अगर malocclusion रिलेटेड है तो फिर FGFR नहीं होगा. So if you are sure, anyhow whatever you mark must be correct only. You would have given the exam, so you know. What I know is अगर malocclusion word है तो FGFR मत mark करना आगे के लिए. अगर craniofacial है, okay, no issues. If you can't recall the full sentence, I have no issues with that. Just I am telling you कि these are the genes. Just write them down or add them to your notes, okay, for future exam. That's why I wanted to take up this question in detail and I mentioned the specific genes. Okay, भी specific अगर craniofacial word है तो FGFR से रखना. बाकी रेस्ट जो जीन्स है वो मोस्टली डेंटिलोजेनेसिस से ज़्यादा लिंक्ड है. TLX जीन, MSX1, PAX9, उसकी वजह से डेंटल डेवलपमेंट या नंबर पे फर्क पड़ता है. That a dentition won't get formed. Okay, so that's it. That were the questions which I got from the recall. If I missed anything or if there was anything which was incomplete, you can just write me, tag me. Just keep on studying. I request every one of you not to stop. Okay, I have told you before as well, INI means either you are in or out. I got a good rank, I got in top 100 but did not secure a seat. That means you are out of it. Okay, and result of INI won't reflect the marks of NEET. It has happened with me as well. So don't think कि अगर INI में अच्छे मार्क्स आए या INI में खराब आए हैं तो NEET भी खराब होगा. You have ample amount of time to reverse that trend. and it has happened not only with me, with a number of people. Okay, I know a number of people जिनकी INI में अच्छे आते हैं but didn't score good in NEET, and vice versa as well. So both of these exams I don't have any link. The only link between them is the course which we taught you. Just keep on revising. If you miss something, कुछ topics pending है, कुछ रह गए, just revise them. Okay. If anything is not clear, you can tag us those doubts. You can tag us to them n number of times. Till the time we don't get answers, they won't get answer. Indian selection matter करता है यार, कितने दिन बाद वो डाउट आंसर doesn't get matter. Innumerable times भी tag कर दो, जितनी बार आंसर ना हो, no one will get angry. Okay, so just keep on studying. Everything will be given to you. कुछ pending, कुछ नहीं मिला, you can write to us. We'll make sure that it is given to you or provided to you in sufficient amount of time. Okay, that too before your exam. So not to worry. That's all I can say. Okay, so thank you for everyone for joining and taking out your time for joining this session. Okay, thank you.